The effect of weather on older adults with rheumatoid arthritis. Do you have an older relative that can seemingly predict rain one day before it happens? It may seem like they're a magician, but in fact, this is their rheumatoid arthritis. The reason why this happens is because right before rain, there's a drop in temperature and barometric pressure. Barometric pressure is essentially the thickness of the air. So if there's low barometric pressure, there's low thickness, which increases the thickness in blood vessels, which leads to joint stiffness and joint pain. And multiple studies have found a connection between low temperature, low barometric pressure, and high humidity that has led to increased disease activity scores in patients. Other studies have found that anxiety, depression, and mood have also contributed to increased disease activity scores in patients. So this also brings up the idea of seasonal depression. Is it a possibility that in the winter someone is just more sad because they're not able to get outside into the sun, and this is why they have pain versus low temperatures or barometric pressure, or could it be a combination of both? Speaking of the sun, low vitamin D scores have been associated with high disease activity scores in patients. This could be due to the fact that when it's raining, people are less likely to go outside, and there's also less likely to be sun. Therefore, they will get less vitamin D, contributing to a higher disease activity score. It should also be noted that there was a study done where 60% of patients believe that weather has an effect on their rheumatoid arthritis. Now, if you think about that for a second, if it's sunny or if it's rainy, you may have the same pain in both situations. However, if you assume that you're going to have more pain when it's raining, you're going to think about it more. So when you think about something more, you're more likely to notice it. After reviewing all of the research, we can confidently say that weather does have a negative effect on rheumatoid arthritis. However, due to all the different varying factors, there's no way that we can pinpoint one causational relationship. So where do we go from here? One of the biggest issues with patients with rheumatoid arthritis is that they are not educated on their disease. So what needs to happen is that therapists need to educate the patients, make sure that they're getting out exercising, into the sun. When it's raining, they also need to be exercising but wearing warmer clothes. And if possible, if they have the funding to do so, they should move to a warmer, drier climate so that they no longer need to deal with the negative effects of weather on mood, anxiety, stress, and their joint and stiffness. Thank you for listening to my TED Talk, and I hope you can take something of value out of this presentation and maybe even bring it to your own relatives so that they can live the best quality of life.